Everyone, we have come with another interesting topic in reproductive health, which is medical termination of pregnancy. So first we'll find out what is the meaning of this and why this is done and when it is safe. So first, what is the meaning of this? This is nothing but the termination of pregnancy before full term. As the gestation period is 9 months complete, so before that, if we terminate the pregnancy, we call it as medical termination of pregnancy, or we call it as induced abortions, right? So every year worldwide 40 to 50 million MTPs are performed, right? So government of India in the year 1971, government of India in the year 1971 legalized MTPs under some strict conditions to avoid its misuse. Now the question is, what kind of a medication or how do we perform this particular technique? We have discussed some methods or some kind of like a medication or some procedures in the contraceptive methods. You can go through it. Next, when do we go with this, or when we have to perform this? So number one, this MTPs are performed to get rid of unwanted pregnancies. Unwanted pregnancies. To get rid of unwanted pregnancies, what is unwanted pregnancy? This is nothing but it's a casual, unprotected intercourse or the failure of contraception during coitus. The first thing. Number two, sometimes in certain cases, MTPs are essential. MTPs are essential in certain cases where continuation of pregnancy may be harmful or fatal to the mother, fetus, or even to both of them. In such cases, we go with MTPs. Now, MTPs are safe during the first trimester of pregnancy. So, second trimester abortions are much more riskier, right? Now, along with this topic, we go with another interesting topic, that is sexually transmitted infections or diseases. We call them as reproductive tract infections, or we call them as venereal diseases. What are these? These are nothing but the diseases which can be transmitted through sexual intercourse. So there are a variety of diseases which are transmitted by a bacteria, virus, or protozoans. Some of them includes, first, gonorrhea, syphilis, herpes, genital warts, herpes, hepatitis-B, there is hepatitis A and hepatitis B. Hepatitis B is sexually transmitted disease. AIDS and trichomoniasis. These are given in the NCERT book, so we are talking about only these diseases. So these are sexually transmitted diseases. There are causative agents for this. Even you have to remember the causative agents of these also. Gonorrhea is caused by Neisseria gonorrhea. Syphilis is caused by Treponema pallidum. This is a causative agent. Genital warts is caused by human papilloma virus. Human papilloma virus is the causative agent. Herpes is caused by herpes simplex virus. Hepatitis B is caused by hepatitis B virus. AIDS is caused by human immunovirus, and trichomoniasis is caused by Trichomonas vaginalis. This is the causative agent. So these are the causative agents for these diseases. Like out of these, like herpes, hepatitis, AIDS, these cannot be treated. Whereas diseases like gonorrhea, syphilis, genital warts, trichomoniasis, if they are detected in the earlier stages with symptoms, can be treated. So what are the early symptoms? We even find out that. Out of these, your gonorrhea and syphilis both are bacterial diseases. Remember, sometimes a question could be asked, which among the following STIs are caused by bacteria? Remember, these are two. Gonorrhea and syphilis both are caused by bacteria. Whereas your genital warts, right, and your herpes, hepatitis, AIDS, these four are transmitted by viruses, caused by viruses. Whereas Trichomonas vaginalis is a protozoan. Please remember these. Sometime a question could be asked, which are the viral, bacterial, protozoan that cause sexually transmitted infections. So this is the classification you have to remember. Fine. I said herpes, hepatitis B, AIDS cannot be treated. Whereas others, if they are found in the earlier stages, that can be treated. So what are the earliest symptoms of these? The early symptoms of these diseases includes, first, there is itching, swelling, slight pain, and fluid discharge. Fluid discharge in the genital organs. These are the early symptoms. With these early symptoms, if the disease is detected, if a proper treatment is taken, can be cured. What are they? All these except these three, right? Herpes and hepatitis and AIDS can be treated. So females are often asymptomatic, so they can remain affected without any kind of symptoms for a longer periods of time. In such cases, if they were not detected in the earlier stages in females, it may result in complications in later. So what are these later complications if these are not treated? The later complications includes, number one, pelvic inflammatory diseases. This can happen, and it can result in abortions. These are for a long time effect, and ectopic pregnancies, and also infertility, which is due to cancers of the reproductive tract, and stillbirths, so giving birth to dead child. So if they are not treated with the early symptoms, if a proper care is not taken, in later stages they can cause all these complications. So STIs are major threat to healthy society. So as a result, prevention or cure of these diseases is a primary concern in the your reproductive healthcare programs. These are STIs or sexually transmitted infections. The thing is that you have to remember the names with a causative agent, which is a bacteria, which is viral, which is protozoans. So after studying sexually transmitted infections, the another important topic is infertility. Infertility is the inability to conceive or produce children even after 2 years of unprotected sexual cohabitation, right? This is what you call infertility. Now, what are the reasons for this? The reasons for this are so many, several, like physical, congenital diseases, or even drugs. And infertility could be in male or even in female. So mainly in male, the infertility could be because of genetic abnormality like Klinefelter syndrome, or hypothyroidism in male, smoking, alcoholism, or wearing tight clothes, or working in furnaces. These are some of the reasons for infertility in male. In female, it could be due to Turner syndrome, hypothyroidism in female, right? Drugs, alcohol, or smoking, or some of the reasons. Any of these reasons could result in infertility, right? Now, various methods are available right now, present, to treat such infertile couple to have children. These techniques are collectively called as assisted reproductive techniques, right? So let us discuss what are these techniques and how they work. The first thing is in vitro fertilization. This is known as IVF or test tube baby program. So what exactly happens in this technique? Here, fertilization is outside the body in almost all similar conditions as that in the body. So this is only what we call it as test tube baby program. So here in this, ova collected from the female or donor, and the sperm is also collected from the male or donor, and these sperms and ova are fused, that is, they are induced to form zygote under stimulated conditions. Now these zygotes are transferred into the female. So this is what you call embryo transfer technique. This technique is only known as test tube baby program. Next, so this in vitro fertilization includes different methods. One is called zygote intrafallopian transfer. That means we are making zygotes outside the body and they are transferred. Now here in this zygote intrafallopian transfer, the early embryos up to 8 blastomeres, stage. The cells in the zygote after cleavage are called blastomeres. Remember this point. 8 blastomere stage, they are transferred into the fallopian tubes, the fallopian tube of the female. This is what you call zygote intrafallopian transfer. If the embryo with more than 8 blastomeres, more than 8 blastomere stage, more than these cells, then the embryos are transferred into the uterus of female, which is called intrauterine transfer. Next, we have one more technique called intracytoplasmic sperm injection. The sperms are injected, sperm is injected into the cytoplasm of secondary oocyte, which is called ovum. This is called intracytoplasmic sperm injection. So these are the three methods or in vitro fertilization, where the ovum and sperm are fused outside and they are induced to develop and get transformed into zygote. Then if there are 8 cells, blastomeres, transferred into the fallopian tube, beyond that we are going to transfer into the uterus, or in case if the motility sperm is less, or in case if the sperm, like the acrosome of the sperm, is abnormal, in such cases we go with intracytoplasmic sperm injection, where sperms are directly injected into the cytoplasm of the ovum. All these are in vitro fertilization. Next we have in vivo fertilization. In vivo fertilization, fertilization occurs inside the body. Here this is going outside, inside the body of a female, either natural or artificial methods, which is known as in vivo fertilization. Fertilization includes 2 methods, that is gamete intrafallopian transfer, which is called GIFT. Here the ova, which is collected from donor female, which is collected from a donor, is introduced into the fallopian tube of the female, who cannot produce ova but can provide suitable conditions for fertilization and further development to occur. So for that, in such cases, we go with gamete intrafallopian transfer, which is called as GIFT. Next, second, artificial insemination. In this, the sperms collected from the husband or from a donor are introduced into either the vagina or into the uterus of the female. This is what you call artificial insemination. So these are the two methods of in vivo fertilization, where fertilization naturally occur inside the body of the female. In vitro fertilization, fertilization takes place outside the body, and those embryos are transferred into the either fallopian tube or uterus of the female.